Myrna is a 62-year-old woman who is seeing her family physician for a routine appointment about her blood pressure. She's an active grandmother of two with an uncomplicated medical history aside from her recent diagnosis of hypertension. During the visit, the doctor realizes that Myrna is eligible for the COVID-19 vaccine and raises the issue. The doctor uses the PrOTCT framework to guide the conversation. She's proactive and presumptive. She offers to share the information she knows. She tailors her recommendations to the patient and addresses the concerns raised by the patient. She then talks through a specific plan to make sure the patient can get the vaccine.
Mirna, you're eligible for the COVID-19 vaccine. That's really great to have you actually protected. Do you need any help getting the appointment booked?
Well, I booked an appointment, but then I talked to my daughter and I canceled it.
Oh, tell me a bit more about that.
Well, she said that I should wait for one of the good ones, that they were going to give me that AstraZeneca, and that wasn't a good one, and I should wait for a good one.
It's hard to know what to do with so many vaccines available, isn't it? I've actually done quite a lot of research on how these vaccines perform, both in clinical trials and in the real world. Can I share with you some of what I've learned?
Sure, that would be great. I mean, I'm only going by what my daughter told me.
I understand that. There's a lot of information out there. It can be really confusing. But now we actually have several studies that look at how this vaccine does in the real world. And that's called effectiveness. And the effectiveness of this vaccine at preventing severe disease and hospitalizations really high as 100%. Now, there are some conditions like age and high blood pressure that are going to increase your chance of being hospitalized if you get the actual disease, COVID-19. So whereas AstraZeneca may not prevent all the infections, it will prevent you from getting seriously ill, being hospitalized, and dying. Does that make sense?
Yes, it does.
And there's actually a recent study from Scotland that shows that even one dose of this AstraZeneca vaccine is as effective as other vaccines at preventing hospitalizations. And all vaccines approved by Health Canada are effective and safe. The best vaccine is the one that's available to you the soonest. In fact, my own mom was offered the AstraZeneca vaccine this week, and I actually advised her to go ahead and have it.
Oh, well, that makes me feel a lot more comfortable. But what's the harm in waiting for another vaccine?
The harm is that each day that goes by, there is a risk of contracting COVID-19, the disease. So the sooner you get protected, the better. I know you're trying to be safe, but there's always some risk. And this vaccine adds a layer of protection. So for example, you've been recently diagnosed with high blood pressure, and we know that that puts you at high risk of getting really sick if you get the disease. And we want you to stay strong and healthy to keep up with those grandkids of yours.
There's just so much different information out there. I mean, I even heard that they don't recommend it for people that are over 65. Like, are we sure this is safe?
A lot of recommendations have changed around this vaccine, and they change as more information comes out. For example, now with more studies, we know that this vaccine is also effective in people who are over 65 years of age. But Mirna, you're not in that age group. We know that your risk factor is having the high blood pressure that puts you at a high risk of the disease. And you have such a good quality of life. And I worry that the disease may rob you of that.
I really do trust you. I mean, you've been with me through a lot and you've never steered me in the wrong direction. If you recommend this vaccine, then I'll take it.
Thank you for saying that. Now, it looks like you've already booked the appointment once and then you canceled it. Do you feel pretty comfortable with the booking system?
It was actually pretty easy. I'll do it this afternoon.
Great. I'm so glad to know that you're going to get protected.
Take a moment to reflect on the conversation you just heard and how it reflected elements of the PrOTCT framework. Note that throughout the conversation, the doctor was actively listening and responded only to the concerns Myrna raised. When more than one concern was raised, each was addressed in turn, directly and clearly, without introducing any new concerns or ideas. She maintains an open attitude that encourages the patient to get everything off their chest, validating language like, yes, it is confusing, or it's hard to know, helps keep the lines of communication open. For more information on building vaccine confidence, access the free educational series for primary care providers developed by the Department of Family and Community Medicine at the University of Toronto. Please note that we developed this scenario to illustrate how to use the PrOTCT framework. The clinical details do not necessarily reflect current vaccine evidence or policy.